So I'm Lu. I'm the facilitator of this panel. I'll be leading the discussion today to really discuss the future of care provider with all the new technology integrate within the healthcare system. What we could expect in the future, what are the new innovations we're integrated already, and also what are the challenges and opportunity for both care provider and also maybe startups to focusing on. So to kick off the panel, first I would like to invite other panelists to introduce yourself a little bit. So we start with Lynn.
Great, thank you. I appreciate the opportunity to be here. I'm Lynn Simon. I'm the President of Healthcare Innovation and Chief Medical Officer for Community Health Systems. For those of you who are not familiar with us, we're mostly community hospitals and sort of the mid-market. We have about 42 distinct health systems comprised of 77 hospitals in 15 states. So a rather large distributed network. We have about 1,000 overall sites of care.
Yes, Mark.
Hi, everyone. It's a real pleasure and a privilege being here. My name is Mark Zhang. I'm a palliative care physician and also the Associate Chief Medical Information Officer focused on digital innovation at Brigham and Women's Hospital.
I'm Diana Deibel. I'm the Chief Design Officer of Grand Studio, which is a digital product design and strategy consultancy based in Chicago. I'm also the co-author of Conversations with Things, which is a book on how to design successful conversational AI experiences. And my industry that I tend to work in is healthcare with a little in food and retail.
Nice.
Hi, I'm Dinesh Gambhir. I'm the founder and president of First Outcomes. First Outcomes builds voice AI assistants for healthcare providers. So we'll make sure that nobody's waiting on the phone if they need an appointment. If they need their prescription refilled, we'll take care of it. If a pharmacy is out of a certain medicine, we'll actually go through and update the entire EHR and say, this is the replacement medicine. We also do patient recall, as well as the best part, what the patients hate, is the Dunning call, where you owe $60, $100, and rising these days. So.
Yes, yes. So I'm Lu. I'm the founder and managing partner of Fusion Fund. So Fusion Fund is a Silicon Valley-based VC firm focused on early stage startup investment. So I've been leading and founding the firm since 2015, and we've been mainly focusing on healthcare, especially AI in healthcare, enterprise network, and industry automation investment. And before I went to so-called the dark side, I was an entrepreneur. So I built and sold my own medical device company and to Boston Scientific, and later, just want to build a different VC firm, so launched Fusion Fund since 2015. So as our panelists introduce themselves, you probably can tell that we have a very diverse panel today, and we'll also tackle the question we have today, the future of the care provider from all different perspectives. So since early this year, I think regardless whether you're in AI or not, you probably already use ChatGPT, or AI is integrated with all aspects of our life industry, especially healthcare industry. We always talk about all the frustration within the healthcare system, the low efficiency, high cost. But on the other side, we're really looking for a solution to solve so-called, I call the AAA problem, accessibility, affordable, and accuracy. And AI become the perfect tool. So based on that, I would like to kick off the first question to all the panelists. What do you think about the general impact of AI for the healthcare system? And also, what are the specific AI technology you are integrate already, or you're doing in-house, or working with a third party? Maybe I will start with Lynn again.
All right, so I'll start with the second half maybe first, some things that we have done already. So a couple years ago, before also the hype of Gen AI, started to work with some systems, mostly in labor and delivery. So we implemented a machine learning AI solution in all our labor and delivery suites throughout all our hospitals that provide that service. So it's about 48 or so hospitals that adopted that. And so we've seen really good trends in alerting the care team and letting the care team, it sort of helped them through the pandemic, when there were shortages, et cetera. They said they felt safer having something that helped them alert to maybe some changes in the patient. So we felt that the patients are safer, which is why we got the system in the first place, to look at maternal vital signs, fetal heart tracings, et cetera. And then we've seen over the last couple of years those trends improve in responsiveness related to changes. So that was probably one of our biggest deployments. So really focusing on, patient safety, quality, but also looking at ways to make us more efficient as well.
What do you think about the general impact of AI in a hospital, a healthcare system like you're at right now?
Yeah, so again, I think we're really looking at it from all different ways. So try to think of, we talk about innovation or AI, it's not like a separate sort of function. It really tries to we tie everything back to what our business objectives are. And so our CEOs define, our near-term objectives, which are to support our workforce, safety and quality, reduce cost, and sort of accelerate our growth. So everything that I think about when we're talking about deploying solutions is it's got to fit into one of those buckets and help us advance our business objectives.
Yeah, totally. Mark, do you want to share a little bit more? Yeah.
Of course. So, I think that AI and these emerging technologies are going to fundamentally define both the practice of medicine, but also just medicine as a whole for the 21st century. And part of my work focused on kind of digital innovation is really thinking about emerging technologies in a more systematic way and exploring kind of what's happening within our system, but also how we can set it up for kind of the future. And to me, generative AI, which is so much in the zeitgeist for healthcare and I think society as a whole, is a fundamental tool that I think is going to change how we practice medicine. Some of the things that we're already exploring at this point is using the tool, this technology, to help with administrative burden, whether it's making notes for messages from patients who reach out to our clinicians faster, or I think a near-term kind of Valhalla use case that we're already seeing so many solutions, so many companies in this space is the use of this technology to create ambient scribes. To me, that is a fundamental technology that is clearly going to hit and is going to change the way we practice medicine. I've been in this kind of game for a little bit, and I remember like these big changes, right? I was old enough to write notes by hand, and then all of a sudden we got to the EHR, and I remember when Dragon was on the computer, and my English is pretty good, but you still had to baby it to make it work. And then we jumped to Dragon now, or 3M or whatever solution. It's so good that you can do it while eating a pizza. And I do it routinely, eating lunch, and it's great. To me, that next jump with generative AI and this ambient documentation is going to be when we have that same experience, but with patients. So when you have that patient encounter, and it just records the whole thing, and it's magic. And when it doesn't work, people will feel it. That's going to be really, really impressive.
Exactly. So Diane?
Yeah, I think kind of the points that have already been made, the idea of using AI to help scale, I think something we've all kind of seen in healthcare over the last few years is people mass exodusing from healthcare. And so being able to take the humans that we have and let them work at top of license and scale the tasks that they are doing. There's been some work that I've done on reducing readmission rates. And rather than having a lot of times people will put nurses there trying to follow up with folks, if you went home with CHF, have you gained 5 pounds in 2 days? That's really alarming. We need to get you in here. You don't need a nurse to do that.
Exactly.
You just need a nurse or a clinician to follow up if that has happened. So using AI to do that kind of both data collection as well as data triage, so that the human can really focus in on what needs their attention and where they need to make their decisions. And then that ultimately comes back to like cost reduction and other things.
Totally. So Dinesh, you're providing the services to other healthcare service providers. So what are the interesting use cases you saw?
Well, the use cases where we get involved is when people can't hire folks for the call center or the front desk, or the costs are too much, right? So we go in, and our number one thing is how do we reduce your hiring costs? Turnover, we've been at providers where every 3 months the people in the call center are leaving. We've heard stories of people being trained coming in, staying till lunch, and never coming back, right? Healthcare is really high pressure, and the people on the phones and the front desk actually get the worst of it when things go wrong, I think. So we're there to help those folks. Our systems go in, they handle the phone calls. We've been in provider systems where the Monday morning between 8 and 10 o'clock, there's an hour-and-a-half wait time to get a response to do something like get an appointment for your baby.
Yeah.
Right? So, and what we found most interesting is this is hitting the smaller physician offices who do not have the financial and the human resource infrastructure, right? They're the ones who are most quickly adopting the AI technologies for what I do, which is front office and the call center.
Nice, nice. Yeah, you can hear from our panelists shared really about AI as a super effective tool to dramatically improve the productivity, cost reduction, which is a little bit different from some of the buzzwords you saw in the media talking about AI gonna replace the nurse, AI gonna replace the doctor. Essentially, it's a tool. It's a tool means it has to be used by human. So we always have human in the loop and also enhance the capability of each player in the healthcare system in order to do a better job. As, for example, Mark mentioned for a physician, right? We have a company, I'm on the board, what they're doing is using AI to do our medical coding, automate the process. Whoever is practiced knows how much doctors hate to do medical coding themselves. It's not necessarily the best use of their time, right? Other things including, I have another company doing medical image enhancement. Instead of patient need to do a high resolution scan for 1 hour, they could do 5 minutes low resolution scan, and AI upgrade the image to high resolution scan. It's even better like Lynn for the hospital system, right? You don't need to buy new machine, you increase the capacity of the hospital with the existing facility. So there are so many things we can do using AI as a tool. So I think the future is really not about the competition between the AI tool technology and the existing player. It's really about doctor who use AI gonna replace a doctor who didn't. Hospital who didn't integrate with AI probably gonna be replaced by the hospital who really have lots of good AI use cases. So this is really the future of the general healthcare system. And another thing is really about the future of healthcare service is personalization. What AI done for the healthcare system is help us figure out the value of all the patient data in the hospital to provide highly personalized services from typical patient engagement to even diagnosis and therapeutics. At last, I really want to highlight one thing. You guys heard us talk about AI all the time. AI is not only generative AI. I think especially in healthcare system, we know there are lots of use cases. We don't necessarily need to use generative AI. Expandable AI might be good enough. Supervised and unsupervised learning, this is also good use cases. And also there are use cases for generative AI. So this is the general trend pushed by AI as a category of technology for digital transformation. So this is kind of all the promising future we're discussing that's so beautiful, integrated AI, but in reality, we all know as a very comprehensive system, I put it that way. When I was a founder, I really hated it with honest. It's just so much layers, so many different hidden information I have to figure out. So we know integrate new things, especially AI, to healthcare system, always have different type of challenge. And on one side is whether people are open to take the new technology. People always resist to make changes. Another thing is healthcare system is highly regulated. And you guys are working with all the sensitive data. There are lots of data privacy and governance issue. So for next topic, I really want to hear from you guys the major challenge you're encounter while you're bringing new technology to your institute. And also what are the solutions and the best practice you are able to push things forward. Maybe I will start this time with Diana.
So I think when I think about all the AI ideas that we get from our clients, because certainly I think as you mentioned, AI is a tool. It doesn't, everybody's very excited, and I think that's almost one of the biggest challenges is that there's so much FOMO and excitement around AI, but not really a lot of focus on, I think as we heard earlier today, on how long this is gonna take, or the types of resources and the types of investment from humans, from systems in order to make it work properly. Yeah. So just helping focus in a little bit the the over enthusiasm, and then bringing in folks who are maybe not as enthusiastic about it, so that they can understand what it is that, like, you know, it's not just robots taking over and performing surgeries, and we're never going to have humans involved ever again. But you can see that, like, patients are nervous about it, clinicians are skeptical about it, front staff and admin are nervous that they're going to get replaced by it.
Yeah.
So bringing these folks into this co-creation process so that they can understand sort of what it is, what its shortcomings are, that they know their job, their process better than any of us are ever going to know it, so they can help inform what is actually the best way to apply AI in this specific scenario, so that we can do all these great things of scaling out, of doing more accurate reads of things like imaging, so we can do kind of all the promise of AI without it falling apart and no one adopting it, because that's, I think, the ultimate fail, is when we make something really cool and really successful, but nobody uses it.
Exactly.
It's not successful.
It's really about engaging the direct use of the technology, like physicians, like nurse, right? Need to integrate with their existing workflow. So how long typically is the education process when you are talking with the institute you're working with, educate them about a proper expectation of AI integration?
So it kind of depends on the maturity level of, I think, every organization. There are some that are a little bit more forward than others. So it can be weeks, it can be months, it can be, we've worked on really long projects. Typically, as consultants, nobody's bringing us in for years at a time. And honestly, you shouldn't.
Maybe that's another incentive, right? Charge them high rate, and then we'll try to learn faster.
But I think for folks that are in-house, and Mark and Lynn, you can probably speak to this, like it is years, because it is a very long haul to sort of start with something small, show the value of that, and then start to integrate that out across the system.
So Mark, do you want to add on to this? Like, what are the major challenges you encounter and how you make it work? You have like different hats you're wearing, and they also understand that their concern and the fear of the new technology.
Sure. I'm a clinical informaticist by training, and we have a very common saying in informatics, which is most kind of things that you want to do. And informatics is really that intersection of technology and healthcare. It's usually not the technology that's the rate limiter, it's the people and process. And with any emerging technology, I think you have to win the hearts and minds while also creating the foundational pieces like governance, like kind of, you know, the data provenance, all those things are so important to be able to enable these things. And importantly, you know, when we think about kind of implementing early stage pilots, and my colleagues across Mass General Brigham, we tend to think about, we use this framework at the iHub called COFT, and we think about if it's a clinical intervention, who's the clinical champion, right? And ideally, it's not just one person, it's like a division, or it's a real pain point that's universal. O is who's the operational champion, like who's gonna endorse this thing and move it forward. And then F is, unsurprisingly, what's the financial like stake? Like what's the funding? Is this a money maker? Is this a money, is this an investment? How are we gonna do this? And then I think with new emerging technologies like AI and other things, I think critically the T is something that we always think about, which is what is the technology alignment? Does this already exist in our stack? Is this a pain point that could be enabled by something we already have, possibly in the EHR that we invested a lot of money in? Or is this truly a time for a net new? So these are all kind of things that we think about as we go. I would say it's not a challenge so much as that's the opportunity, and that's what we're trying to build right now, is kind of those foundational pieces to make it move forward.
Yeah, you mentioned something really interesting. It's about, you know, bringing new technology in, but you also have an existing solution like being used for many years. And there are always people wanting to keep the existing solution. And how to really navigate around that?
As a people in Lynn, I would love to hear your thoughts on like people in process, but I mean, that's change management, right?
Yeah, and that's what I was going to say. I mean, it's really all about change management. Some of it goes to the
So do you actually change the management? Okay.
Or they change, yeah, sometimes. But I think, you know, really, it's sometimes about the culture of the organization and the expectations. In a large organization like ours, who really, as an operating company, you know, you you have to have expectations around some level of standardization and how we're going to operate together. And for the most of the things that we look at from the innovation standpoint is, if we're only going to use something at, one site or one hospital, it's not, to go through all the challenges we have to get a technology introduced. We're really going to look at things that are prioritized things that we can scale. But with that, we got to start small, right? So we sort of start small, think big, start small, move fast is kind of what we say. So really looking at, where are the people that there's a problem that they want to solve, and either they've already solved it. We've had instances where, people have found AI technology, for example, a bedside EEG, and it solved their problem. And then we look across the enterprise and everyone else has that problem too. So if we can find those people, they're trying to solve their own problems. They're the early adopters. That's who we want to look for and work with. And then they can figure out how it works in their workflow or whatever, solve all the problems for everybody else, and then we can scale. So, again, I think it's trying to find the people that are interested in looking at the technology. I'm waiting to hear. I've already heard docs tell me that, I don't believe in telemedicine. Well, that ship has sailed, right? Yeah. So I'm waiting for, I don't believe in Gen AI, but that's not who I'm starting with to test some of these things.
Yes, that's very straightforward. And also another thing is for your system that sometimes there's so many different parties involved when you bring something new, how you really help facilitate collaboration across different divisions and push the technology to integrate.
Yeah, and so I have a lot of folks that I collaborate with and colleagues that are maybe choosing a hospital or two and saying, you're our innovation hospital and you'll help us test things. I kind of have a little different opinion of that. I think I'm going to wear people out if I do that at one or two hospitals. I think I need to look for people that, they have a particular problem, they want to solve it, so we can have multiple pilots of innovation. Some will work, some won't, but if people are engaged and involved in solving their problems with technology, that's where I want to go and test. And with small tests of change, we can see what works. And then we're pretty good, like I said, if people get excited about seeing what other people are doing and what they're achieving, and then again, you get more of, I think, the pull than the push, and we can drive change a little easier that way.
Yeah, that's really impressive. So Dinesh, you are directly, trying to advocate and also push your innovation technology to different players in the healthcare system. So what is the hardest part for your kind of engagement with them, but how you really make it work?
So the hardest part is the processes, even with a two-office provider, are different, office to office.
Oh, okay.
In a large system, departments within the hospital are different, and then you go out to the other hospital, it's totally different.
Oh, okay.
Right? We wind up acting the role of a consulting firm and doing a lot of facilitation. And usually you do need the champion to say, this is the way it's going to be. Some of it is actually, if I can use the word nonsense, because the technology enabled it. We've been in places where there are 500 visit types.
Yeah.
Why do you need 500 visit types, right? That's the number one problem. Second problem is the technology resources are not available on the provider side. So we have to not only build it, we have to integrate it, and we have to maintain it. The EHR, the interfaces just occupy the providers totally. And we get on these Zoom calls, you can see everybody's face. There's the business, they're really excited. And then there's the shell-shocked, like in front of a truck, CIO. And he's totally quiet, and it's like, what am I going to do?
Yeah, but I think sometimes also all this CIO, no matter is for IT or innovation officer, they're also the one trying to bring the technology to push for digital transformation, right? It's just that they are really fascinated about opportunity. They also have lots of pressure.
They have lots of pressure. It absolutely is incredible just maintaining the EHR. the security systems. It's you know, I don't, we just heard about another system being breached, right? So they're in a hard place. Legacy, it's like the old mainframe days. You can't innovate because it's just chewing up so much of your resources. And on the other hand, the business does not have the resources. When we go in, it's because you cannot hire enough people. It's really, after COVID, it's become incredibly bad. In the front office, in the call center, you cannot hire the people.
Yeah.
We've actually had, of all things, outsourcing firms come to us who do call centers in India and the Philippines and say, we want to invest in you and take you to our customers because they're having problems. So it's the same thing as when mainframes were there and PCs came in, right? The mainframe guys still stayed maintaining the mainframes, but everything new went onto the PCs. I think we're at that point. And as you pointed out, the innovation officer is actually a new role, very different many times than a CIO. I think, Lynn, you have that role, right?
Yeah, it's about 5 weeks old, but yeah.
Yeah, it's a relative new role. You know, Chief Innovation Officer and the Chief Digital Officer, this is a relative new title. Yeah, but I think that's a good reflection of the system, different institute, they want to push for innovation. I think for all of us, no matter you're a startup founder or just a player in the healthcare system, you know, this system been doing things like it is for many years. We couldn't expect a change to happen right away. Even technology is so powerful. And also we should respect what's been done in the past. There's a reason for that. Meanwhile, finding the best way to bring in new technology, especially AI, to existing workflow, to do integration first and then upgrade together. I remember a couple years ago, I was talking with some of the AI in healthcare founder. I'm like, you guys are purely AI. You didn't realize AI in healthcare fundamentally is still a healthcare company. You couldn't just assume that I have such a fancy AI solution from Silicon Valley, and you hospital in Indiana, you have to upgrade everything to the cloud with Edge to integrate with AI technology. Doesn't work like that. So it's really about the enablement and the integration. Another thing is, I think from what our panelists shared, this is really impressive that there are so many internal push and also strong interest to bring in new technology for digital transformation. These are the internal cheerleader you could potentially work with. But for founder and also for any technology provider like Dinesh, it's important to identify who is the right cheerleader for you internally to help you, work with you, educate everyone, educate all the collaborators who could potentially contribute to bring the technology and make it happen. I always think that as a VC, as a venture capitalist, not only we're investing capital, we should do more work like facilitate this type of conversation, collaboration. We've been doing this CXO network with lots of the CTO, CDO, CIO from large institute, including Fortune 500. It just connected right away. We were surprised. Not only just like a new position like Lynn is doing with her system as a CIO, also the budget increased a lot. That's what I heard from the member in our network. Some of the healthcare system even have over $1 billion budget under the CTO or CIO in order to push for innovation. So there's definitely bright future, but meanwhile with short-term challenges that we should encounter and also work together to focus on that. Another important piece of the, I won't call it challenge, it's also kind of like opportunity, is really about data governance. Because everyone talk about healthcare, they think about, okay, data privacy and the liability issue. But on the other side, if we didn't utilize the data, actually we're not able to provide personalized solution and really show the capability of AI. Another thing is across different, for example, hospital system, you guys have lots of data, but it's isolated. Now sharing with each other, there's a data isolation issue. So how do you guys think about the future of the data governance and also what are the opportunity there in terms of technology or even system changes to make it available to the general public? I will start with Lynn this time.
So we've been on a journey just for a couple of years now on the clinical side to create a clinical data warehouse.
Yeah.
And so trying to get, and we're not on the same EMR across our system. Our practices have different ones. So getting, kind of the data in so we could utilize that data is very important. So getting close to having that all together, and then we can start deploying some use cases now that we have the data together. We're also going through an enterprise ERP project, so that'll help kind of align supply chain data and others. But the goal now, I think the clinical data warehouse is almost a Trojan horse for getting the rest of the data together. So we can have all our data, that we could use it to solve some of the problems, and then actually discover what some of the opportunities are throughout the organization. So we've decided again to insource a data science team, a team that has large language model expertise and can deliver our own sort of AI solutions. It doesn't mean we can do everything, but that gives us the opportunity to either build, buy, or partner.
Interesting. So Mark, I think you guys have not only lots of data, you also have lots of female data, which contribute to the diversity of the whole healthcare data set.
I'm aware of the time. I think we only have 2 minutes and 30 seconds. So I'm just going to say that data governance is a hard problem and a lot of smart people are working on it. But I do want to just quickly say in the last 20 seconds of my time is that I think AI is great, but it is just another emerging technology that we have to think about. And it is going to work best when we find the use cases that actually provide value like today. All right? And I think that's what we should be looking at. So I cede my time.
Don't worry, we're still a couple more. Do you want to talk about, you said not only AI, what other emerging technology, or maybe within AI, you feel exciting and feel promising in the future?
Yeah, I'm a little biased, but I think that there are other emerging technologies, one of which I'm very excited about, is extended reality and how it can be used in medicine. And I think just like AI, these emerging technologies all require a lot of foundational pieces: the science, the community, the use cases, the investment, the regulation, frankly, to make this work, and of course a payment structure that works. So I think that those are kind of at the top of mind for me as I think about what the 21st century will be defined. It's going to be these technologies, and frankly, these technologies are going to define the new medical specialties that are in the 21st century. The 20th century saw the rise of, I'm making this up, I'm probably going to be wrong if you look it up, but I'm going to say like pediatrics and family practice, definitely, 20th century. The 21st century is going to be defined by new specialties like artificial intelligence, medical extended reality, remote care, telehealth. These are going to be the fields that have true impact, and we're all going to feel them.
Digital biology as well. That's another thing I'm fascinated about. So Dan, you want to continue that? I think that's a really interesting topic. What do you feel the most promising in the future, the new technology within healthcare?
I think that we are not through going through the AI that has existed and finding all the use cases for that. Yes, generative AI is very exciting, but it's sort of like slapping spaghetti at the wall and seeing what sticks. The existing AI still has plenty of use cases, like taking predictive AI models and looking at ORs and figuring out, okay, well, we have all this historical data, we have all this geographical data, we have all this demographic data. Let's figure out when it's going to be high volume in here, when there's going to be low volume, and let's do some scheduling around that so we can optimize the OR for, it's a huge revenue stream. So there's still, I think, a lot of stuff that can be done with successful AI models now, while we're still learning about the Gen AI models.
Yeah, and AI keep evolving as well, right? There will be new functionality came out. So Dinesh, quickly talk on that.
Wow, a lot of good things said. Look, in the future, the care models are evolving really fast. We're asked to work with companies that have vans going to people's houses, right? We're being hit with all sorts of what I would call, how can we cut costs and how can you help us? It's really coming down to the reimbursements are going down, number of people we have to care for are going up, they're getting more diverse, whether they're coming over the border or whether they're staying at home or they're in such difficulty that they actually have to go to a hospital, which is supposed to become the rare occurrence. How do we get the cost down?
Exactly.
Right? The doctors are overburdened because they're not paid enough. So to spend the time with the patient. So what's really driving it is that cost versus demand, and it's going to get worse. So,
Yeah.
right? Somebody asked me on generative AI, when are you going to use it versus your standard NLP pipeline? And I'm like, when the cost is less, right? Because right now, when I go to folks, it's all about what is the cost? How much will it pay me? We have these exciting technologies, but is it production ready? Is it robust? And then what is the cost?
Exactly. You know, most people didn't realize healthcare system almost accounted for 20% of the U.S. GDP. So we spend so much money, our money, you know, taxpayers' money, but we're wasting lots of capital. So how to reduce cost, improve productivity is really essential. We are running out of time already, so thank you very much for joining us for such a rich discussion today. I hope you learned something from this panel. I learned a lot, and also I hope what we discussed today to really show you that I know there's so many applications for AI. Healthcare is not the most sexy industry, but I believe it's the biggest industry opportunity and the most practical opportunity to show the capability of AI. So we welcome more talents and capital player joining force to together we build a brighter future for AI in healthcare. Is the future of the care provider. Thank you very much for joining us.